Smart strategy, real conversations, bigger margins. This is Chasing the Margin podcast.
All right, welcome back to Chasing the Margin. Today we have Dr. Rachel Walker. Dr. Walker, thanks for joining us.
Thanks for having me.
So Dr. Walker and I are kind of new to getting to know each other, so we'll get to know each other within the podcast, get to know a little bit about your background, how you got here, what all you do. So tell us a little bit about who you are.
Well, I'm Rachel Walker. I am the owner and surgeon at Plastic Surgery Center of Dallas. I have my own OR, a whole surgical practice with a non-surgical side as well. So it's been a fun thing to grow over time.
So how did you get into specifically the medical side of things? Why did you choose medicine? How long has it been a passion of yours?
I was one of those weird little kids who I wanted to be a veterinarian, but then I thought it would be too sad. So I think around 8 years old, I decided I'll be a doctor. Humans can talk, so it makes it a little more easy to relate. And I didn't really know what kind of doctor I wanted to be, but I did like working with my hands. So I was like, surgery would be cool, maybe orthopedics. And I honestly didn't know anything about plastic surgery. In Oklahoma, plastic surgery wasn't really talked about. So it wasn't until college when I had to have jaw surgery. And I had both my upper and my lower jaw broken and wired shut together. And it was actually a really cool experience. I did not love the recovery, but watching how a face can be transformed with minimal scars and really impact quality of life. I didn't pursue it for an aesthetic reason. It did have an aesthetic benefit. But I was like, this is something I could really see myself doing. It's kind of the merging of art and science. So after that, I went into med school hoping to be a plastic surgeon and did get here. So I'm happy about that.
Okay. And then you did all that in Oklahoma. Did you kind of move around?
I am a Midwest princess. I did college in Indiana, popped back to Oklahoma for medical school, then moved to Columbia, Missouri for 6 years for residency, and then did a year in Shreveport for a fellowship, and now I'm in Dallas.
Okay. Mm-hmm. Yeah, I think that not necessarily the Midwest side of things, but growing up in an area that wasn't real big on plastic surgery, didn't have a lot of that going on, is something that I relate to you a lot on. I actually want to ask you some questions on that, so we'll dive into that a little further.
Perfect.
So specifically on the medicine side, one of the things that I was curious about with plastic surgery is a lot of people think of plastic surgery and they have like maybe 3 or 4 things that they think of. But plastic surgery, is there lots of specialties within it? Why did you choose to go the route that you went with plastic surgery?
It's honestly the coolest surgeries of specialty. You get to operate head to toe. So I have friends and colleagues that specialize in kids' craniofacial, so cleft lip, cleft palate, craniosynostosis, which is a really aggressive big surgery to reshape a head. And that's something I got to train in residency, and it was really cool. There are plastic surgeons who specialize in reconstruction. And a lot of people don't understand that, like major leg trauma or major cancer resections, yes, they're taken care of by other specialties, like orthopedics fixes the fracture or surgical oncology removes the cancer, but actually fixing the hole is almost always plastic surgery. So it might be removing part of the skin from the back that's expendable and moving it down to the leg and using a microscope to put that together. So those are the microsurgeons. And then weirdly, we have a really big hand presence. So during residency, every other day we were on hand call. So broken fingers, firework injuries to hands, hand infections, that's something that we all took care of, and orthopedic style things like wrist fractures. So it's a very diverse field. I did end up in the classic, what people think plastic surgeons do. So I do aesthetics only, and it's really what fit my personality and my skills best. I would think when I went through medical school, I had a really good understanding of science, but not in like the biochemistry way. I was not a natural researcher. I didn't have that really one-sided science brain. I was kind of a mix of art and science. So I do think plastic surgery, so maybe reconstructive surgery and cosmetic really spoke to me. But then I just wanted more control, and it's a lot easier to independently practice as a cosmetic plastic surgeon, get to know your patients, and have all the things I wanted in a career all in one place.
Yeah, I think that you and I are probably similar as far as like we're a little different than maybe others within me being a CPA, you being within the medical field. The way you describe it is a lot of doctors who are in medicine like to do the research, they like to do the technical side, and you have more of an arts side of yourself. With me as a CPA, a lot of people think, well, we'll just sit in the back room in the closet and just do all of our work, and I actually like to sit down and talk with people and talk with clients. So it's fun to be able to still do things that you're really, really good at, but also do it in a unique way that's unique to your personality.
Exactly.
So, when I was researching you, I saw specifically that you use the word artsy or describe yourself as an art person, I think, on your website. So I thought that was pretty interesting.
Yeah, that was my minor in college was art. And I loved doing it, even though it wasted a lot of time because I was trying to get my med school credits, but it was what I liked to do. So.
Yeah. So going back to what I talked about earlier, I'm from small town Arkansas originally. So you can get to know me a little bit on here. But being in small town Arkansas, one of the things that was always a huge misconception in my mind was specifically around plastic surgery was diving pretty far into like the biblical side of small town Arkansas and how like any plastic surgery has some vanity to it. Mm-hmm. Is that something that you've dealt with or heard about with either being from the Midwest or going to Oklahoma City?
100%. I literally never talked about plastic surgery growing up, and it was an LA thing.
Yeah.
And it's funny now when I'm in it to think that, but as a high schooler, I was like, that's something that people do in LA, just exaggerated looks. It's all about vanity. But now inside of it, it's such a rewarding career, and it really makes impactful changes in people's lives. And I think it's really short-sighted for people to just put plastic surgery in this vanity field, because if you think about most things people do in life, and I will say, oftentimes when I go out and meet people, I do not introduce myself as a plastic surgeon. I just say I'm in medicine. Because immediately if I introduce myself as a plastic surgeon, people have a certain opinion of who I am. They're just like, oh, you did this for the money, or you did this because you're a vain person, and that's not it. Like, I really want to help women feel best in their own skin, and that's why I do it. But things we do every day. We drive nice cars. We wash our cars so they look nice. We do our hair. No one's criticizing people for wanting their hair cut or their hair colored. We honestly criticize people for having sloppy hair. So why not the same with the rest of your body? And I think there's goods and bads to plastic surgery, of course. I think there's some people who fall down the rabbit hole and are chasing things that they probably shouldn't be chasing. But most of my patients are coming in with something that has bothered them for years, and it's a confidence issue. And it doesn't matter if it's mild to the outsider's perspective. If it impacts their daily life every single day, that is something that they should pursue. I just recently had a patient, she was in her 50s, and she said, I have wanted a breast reduction since I was 16 years old. And she was also from a small town, and her parents were like, no, just this is what you were dealt with. You should embrace it. This is who you are. And she's finally in a spot that she's able to do this for herself, and it's going to be exciting for her. She'll be able to buy clothes that she couldn't wear before, stand up straighter, have less neck and back pain. It's a really exciting journey for her. Yes, it's aesthetic, but it's also functional and helps with her mental health.
Yeah, I think that's the way that I understand what you do is there's a lot more to it than just maybe on face value.
Right.
That people completely misunderstand.
Correct.
And I definitely get like introducing yourself a little differently than just here's exactly what I do, because people will judge you right off the bat. Do you have, like in this example that you just gave, a lot of people who come in and have stuff done that not only has a aesthetic benefit, like you said earlier with your situation, but also has tons of health benefits that go along with it?
Correct. Yes, there's almost everything, honestly. I mean, breast reduction is a simple example. Taking a pound off a woman's chest is the equivalent of taking 10 pounds off their back. So, I mean, imagine running with all that weight on the front of you. It's just not good for your spine, for one, and it also makes things more difficult. If we look at tummy tucks, oftentimes as women who've had 2 to 3 kids and their core is completely obliterated by those pregnancies and their stomach muscles are separated, some women can go to physical therapy and fix that. But even physical therapists could come on this podcast and say, I cannot fix all diastasis, because if it's wide enough, it just is not going to fix without being sewn back together. So their core strength is restored. Their ability to go to the bathroom is restored, and that's a huge thing. Or something simple, eyelid lifts. I mean, insurance covers some of them, because once the eyelid skin starts covering the outer aspect of the eye, you literally can't see. So changing lanes becomes a problem. So I think a lot of these surgeries have functional benefits. I think there's a lot of things that we as a society don't talk about freely. Like, as a young woman, I wasn't routinely checking in with my friends, like, is this what a normal breast look like? And I'll have poor women come in and they don't know if they're normal or not. Some of them feel very abnormal, and they're not. Others are just so stressed about their body because they can't wear a bra because maybe they have an A cup on one side, a D cup on the other, and that's very hard to fit in. Like, you can't wear a swimsuit without getting comments made. You can't wear a normal, like, athletic top if you're in sports without people wondering what's going on. So while that roams in the aesthetic space, is still a functional concern.
Yeah. I think that I actually know somebody who's had an eye lift, and it's for the exact reason that you said. Like, it was starting to impair vision.
Right.
It wasn't just, hey, I want to look differently on my face. It's actually something that is hurting my ability to survive and to live.
Right.
I think that, the combination of the physical things that are being affected, and then also the emotional toll or struggle internally, like, there's so much of that people have to deal with, that they struggle with, that you, as a plastic surgeon and other people within your field, get to help those people really improve their lives.
Right.
I mean, I even boil it down in my field with people, they're trying to make money. That's why they come in to talk to us. And it's like, well, why do you want to make money? Well, you want to make money so that you can provide for your family or do stuff with your family. And then you want to do that to ultimately build a stronger relationship with them because it's important to you. So, like, the real reason you want to make money is not for the sake of just having money. It's for all of these side things that come along. And I think that that's what you do for a lot of your patients is, yeah, the aesthetics is one of the things, but the real reason has nothing to do with the aesthetics, really.
Right.
Have there ever been the flip side of that coin where you have people come in and you're like, hey, I'm just not the right doctor for what you're looking for, and you have to turn them away?
Yes. No is one of my favorite things to say. I had someone tell me I'm the only ethical plastic surgeon they've ever met, which is very untrue. I have a whole herd of colleagues who are great. I think, as a most part, plastic surgeons are very wonderful people. They just want to help patients achieve their goals. Unfortunately, there's some louder personalities who are known for being very unethical. But if a patient comes in and, for one, I can't deliver the outcome they want, and I know someone who can do it better, I'm definitely going to send them away. If it's something that I feel like they are chasing for external reasons that's not going to get them the result they want, I will also say no, because if I can't achieve their expectation, neither of us is going to be happy. Sometimes that same patient ends up being my surgical patient down the road. So maybe they had very unrealistic expectations. I'm like, okay, I can't take you from this to this, because you have to stay true to your own body. There's certain parameters that cannot be changed. And maybe they think about it a little more, and they spend some time with themselves and get happier in their lives, and then they come back and they're like, okay, this is all I want. But other people are just unhappy in a moment and are seeking physical change, thinking it will change something else in their life. Like, oh, maybe if I change this, I'll get a better job or a better spouse, and that's not good for either party. So I typically just say no and encourage things that maybe are smaller interventions that could help their mental health, like a simple facial that makes your face look great, doesn't hurt anybody, doesn't have any untoward side effects, and it's also not a huge financial investment.
Yeah. So when you were going through medical school, or maybe even after, was there like a psychological class that you took, or did you have to go through some of the psyche to try to understand people better?
Not in medical school as much. I mean, I think in medical school we learn more about just like the entire holistic patient, like dealing with a grieving patient, which grieving patients and unhappy patients kind of are very similar. In plastic surgery residency, there is a lot of discussion every year. We have to take a test every year, and it talks about looking for psychological red flags and how you can help those patients. But at the end of the day, you're still not the one functionally helping them besides turning them away. So it becomes a pretty awkward conversation because you're trying to protect them and look out for their best interests, but you're also not able to provide what they want. But if you actually can't provide what they want, it's, I guess, a zero-sum game. No one's winning.
Yeah, I got you. One of the things that you mentioned, let me find it here. Yeah, on your website. I always like to look at people's website and see what sticks out to me. It says beauty can mean different things to each patient, and we fully and happily accept all definitions.
Yes.
That was like specifically, I think, on your About You part of it.
Yes.
Why did you put that? Why is it important?
I think a lot of people don't feel comfortable coming into a plastic surgery office. They feel like they need to be, I mean, I guess it was what I thought in high school. It was all these beautiful, tall people just becoming more beautiful, or just a very certain look. I think meeting people where they're at and honoring their best self is important. And I think our office does a very good job at making all comers feel welcome. I can't tell you how many women in their late 60s come in and tell us after the fact that they felt really welcomed and expected to be there, or women of certain different body shapes and sizes who have been turned away from other practices because it didn't meet their standard, which I think there is a certain thing about being like, this is my brand, this is what I do, and I'll just stay in my lane. But for me, a healthy surgical candidate is the most important thing. And medically safe goals is super important. So I'm never going to put a massive implant in someone that's going to ruin their anatomy over time, and my patients all know that. But if they want a little bigger than what I personally like, great. As long as it's safe and they've thought about their goals, great. Or if they want to do some liposuction on their thighs, and is it going to be the most beautiful before and after for the internet? No, but it doesn't make them fit in their pants better, and they have a lot more self-confidence. If I meet that patient, yes, I'm going to do their liposuction because it means a lot to them, and I don't need the rest of the world to validate what they need.
Yeah. Yeah. I think that's, to me, one of the most important things about each one of our guests that come on is they really try to meet people where they're at and try to help them. Like, you're not out here trying to be the most impressive plastic surgeon around. What's important to you is, what does the patient really care about?
Right,
And
right. It's
that's
not the
what sticks
before and
out.
after. Like, I mean, you can cherry pick like these gorgeous women and make them more gorgeous, but that's not why I went into it. I have very gorgeous patients of all shapes and sizes, and I love that for them.
Yeah.
And for me.
One of the other things that you talked about a little bit, and I think this may be part of your practice, is skin in general. So maybe not what's just underneath within restructuring of whatever it is, but also the skin. What about skin is important? Why is that part of your practice?
I mean, skin health is just important to me. Both my parents have had skin cancer, so I believe deeply in sunscreen and taking care of your skin. But it's the first thing that people see. And I think a lot of people are not thinking about the impact of skin. So as we age, after the age of 30, you quit producing collagen and elastin on your own in your skin, and that's a real bummer. So what can you do to continue to keep your skin healthy and young? And that's skin care, that's laser treatments, and preventative things like Botox to help with wrinkling. But I have a lot of patients who will come in and they haven't been wearing sunscreen, they're not taking care of their skin, and they want a surgical skin surgery. But the fabrics is only as good as the fabric is. If you have a worn out pair of jeans that don't shrink in the dryer anymore, you don't take them to the tailor to get them tailored, because immediately when you wear it, it's going to stretch back out. So you have to be cognizant of the limitations of skin. So particularly face and neck, I really do encourage my patients to take care of it just so they can age in their own skin better. And then it becomes another interesting conversation, particularly with GLP-1s around. People are losing a lot of weight. And unfortunately, the skin quality goes with that. And I think that is a hard thing to communicate with patients, that their results can never be as tight as someone who's never gained and lost weight, because their fabric is not as, it doesn't have its integrity anymore.
Yeah. I want to dive into a lot of the business stuff, but you mentioned a couple things that are really hot topics right now that I'd love to just hear your medical opinion, because we've had other medical people on and they've talked about stuff in their field. Specifically, let's start with the Botox thing.
Yeah.
I hear all these opinions on like Botox. Should you get it early? Should you get it younger? There's additional benefits outside of just skin tightening. Talk to me about that, and what should we know about Botox?
I think Botox is a great preventative ager. It's been around forever. It prevents wrinkles from staying on your face. So I cannot frown at you because I am Botoxed, and that probably makes me a happier person because I cannot frown. I think it's probably very appropriately used most of the time, but unfortunately, I see online like 22-year-olds getting Botox. Do they need Botox? Probably not. Are there 22-year-olds who maybe have a more congenitally attached frontalis and form deep wrinkles and might want to start earlier? Yes. I think when you start seeing patterns of wrinkles forming with expressions, that's a good time to start a little bit of Botox. I think if you're not seeing any wrinkles on your face, wait a little bit. But once they're static, meaning they stay after you made the expression, you probably should have started a little earlier if that's important to you. They actually did do a study on Botox that people who are Botoxed are happier. And I do think it's one of those things, like they talk about smile and you'll feel happy. If you're not frowning, you don't feel sad. Maybe that's how it works. I think Botox is great. I think aging naturally and gracefully and having a face full of wrinkles is also great, is what makes you happy.
Yeah. So it goes back to what we talked about earlier with what makes the patient happy.
Right. And I mean, you can choose all day long to sit. And like, I have patients who come into my office and they're like, holistically, I just don't care about naturally aging or not, but maybe they feel corporate pressures because they're on Zoom calls all day, or they're just looking old in their field, which is unfortunately maybe part of the game. Doesn't mean you have to like it, but do you want to do something about it, or do you want to just be a champion and say, I'm going to keep going this way, be really great at my job, and just take the comments about appearance or age? I mean, I think anyone should be able to do great at their job regardless of how they look, but that's not always the case.
Right, yeah. The way that things should be and the way that things are not always the same thing.
Right.
So one of the other things that I've heard about Botox is it helps prevent migraines. Is there any truth to that?
Yeah, so Botox is a very great migraine preventative in the right migraine. So people who get vascular spasm migraine, Botox works by stopping that vascular spasm. Okay. So it's it's a paralytic, so it stops that spasm from happening. So people who get basically temple or occipital migraines are generally a great candidate. Also, people who get tension headaches from clenching their jaw, or maybe they are somebody who has really poor posture at work, like most surgeons, and have a lot of abnormal neck tension. You can Botox those muscles to prevent that reflex jaw clenching at night, which then causes a headache.
Yeah, well, I don't think CPAs are known for having great posture at work either, so maybe we're similar in that aspect. The other thing that you mentioned is GLP-1s. So that's obviously something that's become very, very spoken about in the last few years, I guess. Yeah. What exactly is the benefit of a GLP-1? I think probably most listeners know what it is, but maybe on a high level, tell us what it is.
Yeah, so I think GLP-1s are one of the best things that have happened in modern medicine because they are a drug that can make us healthier when used right. So at the end of the day, they are used for weight loss. There are also some anti-inflammatory properties that have pretty good science behind it as well. But how it works for weight loss is it decreases the transit time in your GI tract. So when you eat, things move slower, so you feel full faster and feel full longer. It also impacts a hormonal pathway, which changes how your body responds to its insulin, which is awesome, and particularly awesome for women. So women historically have not done as well with weight loss drugs as men have, and it's because our hormones are different. And GLP-1s, the hormonal side of them, has helped women a lot more. I think when used right, they are an amazing drug. I think just like a lot of good drugs, when used wrong, they are horrible. I think there are some people who are becoming anorexic on GLP-1s. I think there are people who are using them to lose weight and doing absolutely nothing else for their health, which is not useful. So that's when you're seeing muscle loss, hair loss, skin thinning. So none of those are valuable. The goal is not to be skinny. The goal is to be healthy. So the best people are the patients I've seen who were already working out, they were doing great diet and they just weren't losing weight, and they get on a GLP-1, it helps them get there and their body's kind of jump started, and that's wonderful. But I've also seen the converse. The person who gets on it drops 40 pounds, is eating just Tostitos in the day and no protein. They're not working out. They're not doing anything to build muscle or taking in any protein to support building muscle. So they're going to age prematurely, but just be skinny while doing it, which is not the point.
Yeah. Yeah. So it can be a very dangerous thing.
Yes, I think there's a lot of unregulated use. I think it should be used correctly. I think it should be combined with nutritional counseling as well as an exercise program. But it's like, where does that line stop? A doctor should put their patient on it and say, yes, eat well and go to the gym, but you can't personally take your patient to the gym.
Yeah.
Like, going to the gym is hard unless you like it, right? So people who aren't used to it, or even if you do like it, I mean, there's months of my life that I haven't been in the gym very much at all, and I like going to the gym. It's just life got busy. But it's just responsibly using them. I think if I were to have a crystal ball, I imagine in 5 years we'll have better scans to look at, like, that go with the drugs, so we're really tracking like fat loss versus muscle loss, which those exist now. I just don't think they're commonly done. But maybe you lose your privileges of using a GLP-1 if you're not taking them appropriately, because losing muscle mass is a real problem for an aging person.
Yeah. One of the podcasts that I listen to that is a business podcast talks about GLP-1s in a business sense. And he actually said that his stock pick for this year is GLP-1 companies because he feels like, at least this year, I think is the way he phrased it, GLP-1 is more impactful than AI is because of all the downstream effects of someone's health.
Right.
Like you said, or you can maybe give me more insight since you're the doctor here. But he talks about how GLP-1s can help people lose weight, and then it's almost like this compounding effect. They lose weight, then they stop needing to take certain medications because they're losing weight, they're getting in better health. Maybe it encourages them to do the opposite of what we've talked about with, hey, they lost a little weight, maybe they feel more confident to go to the gym, then they start doing things to build muscle, and all of a sudden all these positive things start happening, and then they start eating healthier because they've lost this weight. They don't want to just go to a McDonald's or a Taco Bell. They want to go buy groceries.
Yeah.
Is that kind of what, I guess, the optimistic view of what GLP-1s can be?
Yes, this is very true. I mean, I have seen so many patients, they lost 100 pounds. They're no longer diabetic. They don't have high blood pressure. Their cholesterol is normal. They are back to the gym because their knees don't hurt from carrying around 100 extra pounds. They're wearing clothes that make them feel more confident. They are excited about just being back in a energetic version of themselves. And I think that's really, really cool. I also think that GLP-1s reduce like food noise. So some people are just constantly thinking about food, and they show that in addiction too. Like, it's a great drug for people who are addicted to alcohol, probably in a more casual way. You're just not wanting to like have that extra glass of wine. So some of the unhealthy habits in the right patient are nipped by that GLP-1. So if you're not drinking 4 glasses of wine on a Wednesday night, maybe you wake up Thursday and you walk your dog for 2 miles, or you go to the gym because you don't have that hangover from the bad habit the night before, or just like a really terrible meal and you don't feel great the next day. So I think it all works together. A healthier body is just a happier body, and you have more energy, and then you can do more of the things that are actually healthy for your body to do.
Yeah. This is something that I'm sure there's major differences here that I just don't know because I don't know medicine very well. But I look at things like a GLP-1, and it seems almost like a miracle drug. But I feel like, going back to whenever it was the 60s, 70s, 80s, like Oxycontin came out. And like there was this drug that was amazing, but had all of these huge negative side effects that nobody talked about because it was so new. Is that something that could happen with a GLP-1 because it's such a new drug?
I think yes, 1,000%. But they're not that new. It's just they're now massively used. I think what we're going to see, and we'll see it in headlines, and we already do, is like hair loss, These people aren't getting their hair back from GLP-1s. But is that the norm? No. Is that maybe a sign of unhealthy weight loss? Yes. I mean, just like any major weight loss. It kind of reminds me back in the bariatric surgery boom when everyone was losing weight really fast after bariatric surgery, and it had just really caught on. So a lot of people were doing it, and we didn't have a great hold on the nutritional management of bariatric surgery patients. I think we have a better hold on nutrition just as a medical specialty and use dietitians more. But the bad things that can happen with GLP-1, like I said, malnourishment. But if you're on really high doses, you can slow your GI tract down and it might not want to speed back up. And that's not a good thing. So I think there are like case by case uses that can become really bad. And I think if we're not dispensing them in the right way, having the right patient clearance, the right conversations with patients, there of course is going to be terrible things. But if you think about Tylenol is one of the most toxic drugs on the market when taken wrong. But it is a fantastic over-the-counter pain reliever and should not go away. But you could find whole like Reddit threads on why Tylenol is the worst thing in the world. So I think the same will happen with GLP-1s. Do I think it will ever be to the extent of OxyContin? I think since that could be a pleasure drug, probably not.
Yeah. So let's dive into one of the big reasons why you're on here. Not only did you choose to get in medicine, but you, which is already a difficult thing to do. It's got a lot of criteria to get in there, but you chose to also become a business owner in medicine. Why choose to make your life even more difficult by not only being a surgeon, but also having to own your own business?
That's a great question. It's funny because I definitely work more hours than a lot of my peers who work in a hospital because my business is my baby. And why did I do it? I wanted to be able to provide the experience I wanted for a patient. I wanted to spend 45 minutes with a new patient if I wanted to. I wanted to control the patient experience and the team I have around me. And just the feeling when people walk in our door, they feel happy. They feel like they're in a peaceful place, not a sterile doctor's office. My team knows patients' names. They can get a hold of us easily. It's not some 8-section phone tree in a hospital and you hope you get a call back. So I really just wanted to be able to control the patient experience and control my own joy at the end of the day. I get to walk into a clinic room I like to be in and hang out with the team that I love and spend the time with patients because that makes me happy. I like getting to know my patients.
Yeah, we had another surgeon come on that was an orthopedic surgeon, and the way I understand how he works and the way I understand how you work is definitely different because I think he has to do a lot of his surgeries within a hospital.
Right.
But I think your surgeries are specifically done at your office. Is that correct?
That is correct, which also gives me better control because I know that I'm an efficient person. I'm always on time. I don't go to work late. I don't have to worry about the person ahead of me taking longer in the OR. Of course, if I need to take longer in the OR for my own patient, I also have control over that. I have my front desk call the next patient and say, hey, we're running behind. So there's not a lot of bureaucracy that stops me from providing the patient experience that I want. I mean, of course, there are the headaches, like when somebody hits a power line outside my office and powers off in my building for 8 hours. We have a generator for the operating room, but still not responsible medicine for me to put someone to sleep on generator power.
Has that happened?
That has happened 3 times. There is a freaking power pole on Preston crossing over 635 that people love to hit, and it will knock out the entire side.
Oh, my gosh.
I know, but I have a really great generator, so if I am already in surgery, yes, I can finish the surgery and it'll be fine, but the rest of the surgeries for the day would be canceled.
Yeah. Yeah, we office in Addison, and anytime the power goes out, it's a nightmare. We don't have a generator because it's like, well, I guess we'll just go home.
Yeah.
It's not a big deal for us. You can't just go home.
Use my home OR. No.
Yeah. So I've learned through listening to some of the stuff that you've talked about on other podcasts that not only did you are you a business owner, but you actually bought this practice from someone else.
Correct.
Why did you choose to go that route? Is it common to buy from other doctors, or do people normally just start right out on their own?
It's pretty uncommon to buy.
Okay.
I wanted to buy because I wanted the building. The building that I'm in is beautiful. It has its own OR. Building out your own OR is expensive. Also, I think there's some saying about if you want to know the path ahead of you, ask the person who's coming back. And Dr. Stagnoni built a beautiful practice, and he figured out a lot of the things that I don't need to reinvent the wheel, like how to set up a phone line, how to have a website. Yes, I've changed the website a lot, and I've changed everything about the practice, but like the nuts and bolts were already there, and then I got to change them as I saw fit. It's also a beautiful location so people can see it. I have parking, and that was hard to find in Dallas, is a place with parking, a place I could have sinks in each room. So I was actually looking at buying dental offices that were for sale. And so I was working with a broker, and they were like, oh, we actually have this medical practice. So I signed some NDA, and they didn't send me the address until like 2 hours before the meeting. And I pull up, and it's the Plastic Surgery Center of Dallas. And I'm so tickled because when I was a fourth-year resident, I had flown to Dallas from Columbia to drive to Shreveport for an interview for my aesthetic fellowship, which wouldn't be until 3 years later. And I passed Plastic Surgery Center of Dallas, and I'm driving down 635. I was like, oh my gosh, I wonder who owns that. And once I got to Shreveport, I Googled it, and I was like, Dr. Stagnoni. I couldn't pronounce his name. And I was like, that's really like the pie in the sky, is to have something like that, your own standalone building, clearly very well taken care of, clearly a man who took pride in the experience he was providing for patients and wanted to do an excellent job, because you do not go out and own your own business because you're lazy about things. And so when I pulled up, it was like this weird moment for me, because it was like 3 years ago, I remember passing this and thinking it was the coolest place in the world, and now I have the opportunity to buy it. And it was great. And I think if you're going to buy, you need to know the surgeon you buy from. I didn't personally know Dr. Stagnoni, but I asked around, and he had a great reputation. His reputation online was great. When I went and like did all my internet sleuthing, of course, there's always going to be some bad things said, but for the most part, it was all excellent. So the patients who he had, they will still come back to me, and that's great. And I continue to provide excellent care, and I would 1,000% do it again the same way.
Yeah. Was the whole purpose of looking for the real estate, like you talked about the specific things that you wanted, which all kind of go back to control, which seems like you like to be in control of a lot of things. Was it more that? Was it looking at the real estate from a financial point of view as real estate appreciating? Was it a combination of both?
Probably a combination of both. I would say control is number one. When I was looking at places I could lease, I would talk to these buildings and say, well, can I add sinks? And like, well, you need to get permission from the people above or below you. And then I would ask, would I be able to add my own OR? And every single building in Dallas had some story about a liposuction canister blowing up and fat all over the walls, which literally does not happen very often. I mean, it's maybe happened to one surgeon in their career, like every 10 years. I don't know. It's not common. And I'm like, how do you all know the same story? And also, if it did explode on the wall, you clean it up. So why is this like a death sentence for ORs and buildings? Or some buildings were not eager to have people who were operated on come in. I'm like, these aren't like, we were coming in bleeding everywhere. These women look largely normal the next day. They might just be walking a little slow. So there was a lot of weird things when I was looking at renting. OR time is also hard to come by. So in a hospital, you can get OR time. Surgery centers, you can get OR time, but you have less control. And I was like, well, if I could have control, that would be better. And I also had decided to move to Dallas, and I wanted to stay here. So I didn't really want to be hopping around. So I was like, why not just bet big, go big or go home, and try to go after the dream I actually want, instead of starting in one spot and then jumping to another spot. And then when I'm actually busy trying to build out an OR, whereas when I wasn't busy, I was learning how to run a business and taking great care of my patients and really buttoning everything up. But right now I couldn't imagine trying to build out an OR.
Yeah. I listened to the podcast that you did with one of your friends, and you briefly talked about the numbers behind what you brought to the table when you're going to make this decision to move forward as a business. And it seemed like it was a huge bet on your side, maybe even, I don't know anything about the financing, but maybe even the financing side as well. So on the real estate in general, how has that kind of panned out since buying the business? Is it something that's really helped the business, you personally?
I mean, I like it for, I'll have something to sell. I also like that I am in control of my own rent. and no one can kick me out of my building. So I like all of those things. There are definite headaches, though. I mean, I paid $85,000 for a plumbing problem earlier this year, which I did not love.
Yeah. Yeah. Was there anybody in your background that had like business experience that really kind of pushed you into the business side, or was it really just something that you stumbled upon?
I would say my mentors in Shreveport, Dr. Simeon and Dr. Holly Wall, they owned a beautiful practice. They had a standalone facility, very similar to mine, and just they ran it perfectly. They had a great team. They were great surgeons. Their patients loved them. And I was like, this is what I want to do. And Dr. Simeon Wall, he's a really like awesome business mind. He loves business. Like he studies business. And so I talked with him about it. And he's like, what's your risk tolerance level? And I was like, I think it's high. He's like, are you sure? So we'd hit it back and forth for a year. And he's like, I think you can do this if you want to do it. And happily, I have had some really great mentors in my life. So I was like, if things go south, I can call them. But also at the end of the day, if I didn't win, worst case scenario was bankruptcy, and I still have employable skills.
Yeah.
I can still find a job. I can climb back from this. I don't think that's going to happen. I think I just need to be smart about things. So I didn't pay myself for the beginning. Then COVID hit. And that sucked because I couldn't get a PPP loan because I just had 2 hourly employees and myself who wasn't being paid. But like the bright side was I got to be able to operate more quickly once operative restrictions were lifted because I wasn't competing with essential cases because I was the only person in my OR. It couldn't be used for all the medical cases that were backlogged during COVID. It was just my OR, and as long as I had supplies, I was welcome to use it once they lifted elective surgery ban.
Gotcha. So I have an opinion on why I think you did not choose to do this, but why not choose to just partner with the people there in Shreveport? You were close to them. It seemed like you got along with them.
Yes, I think about it every day because I love them. They are some of the best people in my life, and I would have loved practicing there, but I wanted to be closer to home. I wanted to be in a bigger city. My brother and his family moved here the same year I was looking at where to go, and I love having them nearby. My parents were still in Oklahoma, and it was a quicker drive to get there. And then my sister was moving to Dallas too, so it was just great. I love to travel. I love food. And there's a lot of good food in Dallas. So I have 2 airports, great food, and it just seemed like a great place to be long term.
Yeah. Yeah. The town that I ultimately graduated from high school was about 45 minutes north of Shreveport.
Yeah.
So
Yeah.
I've driven through Shreveport a lot.
I know. Who knows what would have been different if my like personal life would have been different when I was there. But like, had I had young kids, I think maybe I would have stayed in Shreveport. But I'm a proud mom of 2 bulldogs and a cat. I have a wonderful fiance that I met here in Dallas. So Dallas worked out for me.
Yeah. The other thing that you've mentioned a lot and that I see a lot within medicine is mentorship. So is mentorship something that has played a huge role? It sounds like it has. What are some of the most important things that you would look for in a mentor or somebody that's getting into medicine? What should they look for?
I think looking for someone who will shoot you straight. I think also not caring about the naysayers. I will tell you my entire career, starting in college, I remember sitting across from my college advisor, and I came in as a pre-med saying, are you sure you want to apply to med school? Like, it's really hard to get into. I was like, I hadn't thought about that. And I did it anyways, and I got into medical school. And then in medical school, I was told plastic surgery is too hard to get into. You should backup apply. I was like, well, quite frankly, I didn't go to med school for 4 years to become a surgeon I didn't want to be or go into a different field. So if I don't make it, I'll take a research year and figure it out. But I got into plastic surgery. And then one of my favorite mentors, in residency, he told me not to do an aesthetic fellowship. But he didn't understand the reason why I wanted to do it. I wanted to do it, and I chose Shreveport because they were running a private practice facility with excellent surgical results. So I wanted to see that combo. Like, how do you do it outside a hospital? Because most plastic surgeons are trained within a hospital. So that's what you see. So I wanted to spend a year. I was very well surgically trained from my residency. I got to get other awesome new techniques while in fellowship, but I also just got to see how a business should be run. And so that was very valuable. So in terms of what do you look for in a mentor? I think someone who's willing. I think someone who's taken an interest in you probably matters. And look in unlikely places. Honestly, one of my best mentors in medical school was a general surgeon. And he wanted me to become a general surgeon. And I think I would have been a great general surgeon. I just wouldn't have liked it. But I listened to everything he said. And he, at the end of the day, was modeling a lot of the things that I still use in my career today. It's just a different specialty.
Yeah. Going back to what you said about the PPP and, the beginning of getting into all this, one of the things that I'm always intrigued by is when people either purchase or start and they go through these ups and downs of business.
Yeah.
And it seems like regardless of how long a business is around, there's still ups and downs. It's just they look different.
Yes.
Has there been any other times, or talk to me about that time when maybe things were a little tougher? What did you have to do to fight through to stick around?
I mean, I think it all just goes back to you just have to keep swimming. I have amazing parents. They really taught me grit and resilience. And I think every bump I have hit has made every other bump seem smaller. And I react less in a good way. It has not been an easy journey. I actually get to talk to residents and new graduates every year at the aesthetic meeting about successes and failures and pitfalls of starting your own business, because my launch into business was so aggressively terrible. I mean, I had COVID. I got divorced. I had a flood that demolished my newly remodeled space. And then I had another flood. And it was just a lot of bumps. And then there's always going to be a bump. And so I think that's part of it is things are going around smoothly. And then maybe an employee that you thought was going to be with you forever, like, leaves. Or maybe you have a patient issue, and that's traumatizing. Like, at the end of the day, the hardest thing I do is taking care of patients. And if I feel like they're unhappy, that wounds me the most. But just sitting there and being sad about whatever bump is hit is not useful. It's like, take the next step. So I remember during COVID sitting there thinking, I have this line of credit that's going to run out. I'm not going to be able to live. It's like, what can I do to change that? Yeah. So it's just like, keep climbing.
Yeah. I talked to the managing partner at our firm, and her and I are really close. I've been with her for over 10 years now.
Wow.
So, and chose to stick around and join her in an equity position. But she talks about, there was times where she had to pay everybody else, and her name's Annie, and Annie didn't get paid. Mm-hmm. Have you been through that struggle yourself?
Oh, yes. And I think it matters. Like, I think one of the reasons, too, I went into business is I love growing people. And maybe I think the things that bring me the most joy are the really happy patients who I just see shine afterwards, and employees. And they deserve a mentor. And I have been so thankful to have a mentor, but I have a full team of women, and it's really fun to watch them grow and watch them conquer hard things, because they can do hard things. They can learn more. And somebody talking to them about different, maybe business things than they've thought of before. Maybe they thought it was just a front desk position, but most of the girls who've started at my front desk have grown within the company, and that's been really fun.
Yeah. Have you already crossed the bridge, or do you think you'll cross the bridge of doing exactly what you were allowed to do at the Shreveport Clinic with bringing in younger doctors and having them help with some of these procedures?
Yes, I would definitely love that. I do miss the camaraderie of having another physician. And I also, I would maybe once a year like to go on a vacation and turn my phone off. It just, that doesn't exist right now. But I do miss having a colleague and a coworker. I just want to set it up right so I can feed a new young surgeon and can truly mentor that role and it be something that's mutually beneficial. My lawyer always raises an eyebrow at me because none of my employees are under non-competes. I mean, I don't know if they're legal anymore or not, but I'm like, if someone doesn't want to be here, I don't want them there. So, and I would like that to be the same with a surgeon. If I'm not creating the value you want, you can leave. So I want to make sure I am offering the best of the best. Why would you ever want to leave this? And grow a team who wants to kind of have that same culture and same treatment of patients. And 'cause, I mean, at this point, I have wonderful patients. Like any physician would be lucky to have my patient base. So if I can keep growing that and have someone else come in and have the same team who cares deeply, it's just a really cool thing that you don't get to see often in medicine just because of the bureaucracy of medicine.
Yeah. Yeah. I really agree with what you're saying I want to create a business where the employees want to be there and that's what ties them there, not some legal document or
Right.
some dumb agreement that they don't like, I don't like, and then all of a sudden we're fighting each other over things that we just disagree on.
Right.
We within our firm have done what's called EOS. I don't know if you've ever heard of it.
Yeah.
Do you have anything on your side where obviously you have all this stuff that you do for the medical side of what you do, but is there like business processes, systems, operations that you kind of live by?
So I would say, as you already mentioned, I had no business training going in at all.
Yeah.
I remember day one, it was November 1, 2019. I'm sitting at this old wood desk, and I hadn't remodeled the office yet, so it was very like Tuscan and manly and fit the retiring surgeon very well. It was very beautiful. And I had QuickBooks for Dummies, and I was trying to figure out how to run my first payroll for the one employee that I did have, and like how to withhold taxes. So I have like Google, I have QuickBooks. I'm like, this is going to be a lot. But something that I have always been into, and we were talking about it before we started here as podcasts. I started listening to a lot of business podcasts, late residency and in fellowship. And I'm a big Andy Frisella, Ed Milet, and Alex Hormozy fan. And they have a lot of just, for one, I listen to it and I get amped up and I'm like, okay, this is why I'm doing this. This is great. And so their principles are how I run my business. Should I be a little better at putting like true standards? And that's on my 2026 to-do list of like getting things really buttoned up and streamlined. Because up until this point, I've been like surgeon, manager, practice owner, and I have to step out of some of those roles. So I need to be able to just get what's in my mind out better. But I think really like just personal excellence and providing value without expectation are kind of like my business mottos that I try to live by. And
yeah, I think that you're definitely on the right track and you're definitely going to learn. Annie, who's our founder, is a little older. I won't talk about her age, but her and I sit next to each other at the office, and that's what I tell her all the time is like, when I first started, I think I was like 7 or 8 of our team, and now we have over 40. And I think your team is close to 10.
We're like 15 or 16 right now.
15 or 16, yeah. So you're still small enough to where you can control a lot of it. And Annie was very similar to you, where it's like she always had her hands on things because she cared. Like she cared about the employees, she cared about the clients. She always wanted it done the best way it could be done. And now we're getting to a point where she can't do that anymore. And it's this constant struggle of like she wants it to be done a certain way, and it's not in a forceful way where it's like, oh, this is Annie's way, it has to be done. But I can see it take a toll on her. And it's over the last few years been this push of, Annie, you've got to stop doing this. For you, it's you've got to stop doing all the surgeries, Dr. Walker. You've got to let somebody else do some of this stuff. But I think it'd be really interesting over the next few years to watch how your life changes and how the practice changes with letting things go.
I mean, I've really this year been deep diving into like how do you we have a great culture at the office and I love that, but how do you keep it going without being the main culture creator, and how do you set expectations with new hires, and like what can I do differently there? Because honestly, my hiring standards have been like, I meet you, I like you, you gave me good answers, you're on. And let's follow someone around for a day, which is not great. I just have really good people on my team who have excelled in that really wishy-washy onboarding process. So how do I button that up? And how do I get the point across that these are the ways we do it? And these are the standards we hold, and having a little better corrective action for like, okay, this is how this violated that standard, not punishments, but just reminders so that every single person is aware of every goal without me having to be the only person guiding those principles.
Yeah, I think that's one of the things that I've learned the most over the last couple of years with, that's how long we've been doing EOS.
Yeah.
Is in my mind, I think we clearly communicate everything down. But then when we talk with other staff members, there's these questions of like, this is not clear of where the business is going. And it's like, how is that not clear? We've talked about this. But it's just learning that people communicate differently with each other, or they understand things differently, and people are different, kind of like the whole motto of what we talked about earlier. Just people are different. They hear things differently. And learning people is the fun side of business, and getting to know them. I don't think we've talked about this, and I definitely want to before we have to wrap up. What are some of the more challenging things that you've learned through the process? And then what are some of the unique things that were really enjoyable that you weren't anticipating with starting your own business?
I mean, I think the challenging thing is just the business. I would say, like, I love going to work. I love my job. I love all the parts of it. But I think no, like, entrepreneur has 2 great days in a row. Like, there's always going to be some like hiccup, something that you have to do. And I think I'm very good at performing without recognition. Like, no one's going to come and be like, you're doing a great job. I mean, my fiance tells me that all the time, but but like outwards, you can be giving all yourself and still like feel like you're taking it on the chin. So I think that's the challenge, is just reminding yourself, like, there are just maybe some months that are a little hard and you're just like, ugh, I'm a little tired, but like reinvigorating your motivation, because motivation doesn't come to you. You have to seek it. So I think that has been challenging. And I think realizing you can't be great at all things all at once. Like, I've let my yoga habit slide and that makes me sad. So I need to figure out how to like rebalance that part of my life.
Yeah.
I will say the rewarding things has honestly been mentorship things. I have patients and team members that I feel like I've become a mentor to. Like, one of my first employees, she joined me at 19, and this girl, I met her, I was like, I need her. And she was doing online college and working in a print shop at age of 19 and knew what she wanted, very mature, and started at my front desk, grew to be a practice manager, and had told me when she started that she wanted to be in aesthetic sales. And I knew her journey. She is married, has a lovely husband, wants to start a family someday, wants to live closer to home, which was not by my office. And so I knew I would lose her someday, and I did. But it was such a valuable part of my journey. And when she quit, I was excited for her. Yeah. She had a great opportunity. She was reaching her goals. And if I became a factory of women who were learning skills, performing excellently, and then getting to where they needed to be, I would be very pleased with that. So I think that's something I didn't know I would love as much. And I also have patients. It's really fun to have young patients who maybe are coming from a place they've never seen, like a whole team of women or a woman doing XYZ, or maybe, I mean, I'm known for wearing high heels and having my hair done, but I'm also in a like traditionally male field, and that makes them feel like, oh, this is fun. And I also still smile. Like, again, I don't typically fit like what the public thinks of a female surgeon. Like, I bring my cat to work. I am a happy, bubbly person and love to eat food. And I think it's fun to authentically be myself and see patients that way. And I didn't expect that from the business. I went into business to have control, but I also got some happiness.
Yeah. Have there been any patients that have come to you that have been either inspired to, even younger or older, to either start their own business or maybe go into your field specifically?
Yeah, I've actually had a couple of patients who were either going into med school or wanting to go to med school that I either got to know, they come to shadow me, or one of them, she just matched into family medicine out of med school, but she spent an entire month with me because she's like, you know what, I want to have my own family practice office. And now seeing her, I mean, I wish she would have matched in Texas because I would get to see her more often, but she matched in North Carolina, and she's going to have, they're lucky to have her there, but maybe she'll move back to Texas and start her own family practice, and I can refer patients to her because she's going to be great at what she does. But I think being a surgeon who can spend time with the patients is a very lucky place to be, because I get to know about their lives, their struggles, their successes. So it's really fun to see. And I get a lot of female business owners who come to me, which is also exciting just to hear. I mean, you love talking to business owners because it makes you happy and you're like someone who is a growth-minded guy, and it's fun to have those interactions with people.
Yeah, for sure. Well, let's wrap up with just a few fun questions, and then we always wrap up the same way at the end. So you mentioned you're a big foodie. You love to go eat.
Yes.
I also read that about you, so it's obviously a passion. It's out there at several spots.
Yes.
Where are the best places in Dallas to eat right now?
I deeply love Namo. I'm a big raw fish fan, so Namo is one of my favorites. Nona will always be up there. If I could eat pasta every day, I would. So I'd say those are my top two. And then Dan's Bagels. I know we briefly chatted about that earlier today, but Dan's Bagel is just superior. It's a sourdough bagel and will change lives.
All right.
Yeah.
All right. And then you mentioned the doggos a couple times.
Yes.
So why bulldogs?
When I was in medical school, medical school is weird. When you're doing plastic surgery, applying to it, you start applying like at the end of your third year, and you have to set up like rotations at other schools. So like I moved to Pittsburgh for a month and I moved to Ann Arbor for a month. But then after you get done with your sub-Is, you kind of get a little let down, and the rest of fourth year of med school is a little easier because you front load your schedule. I was like, I just want a dog. And I already had a wonderful cat, but I wanted a dog, and I knew I needed a lazy dog because I was going to become a surgical resident. So not a dog that needed to walk 2 miles a day. So I was like, I just want a bulldog, and I'm an insane person. And while I was in Michigan at my sub-I, working 80 hours a week, enjoying it, I found this bulldog online, and it was affordable. I mean, I was on student loans. I was like, there's something wrong with this bulldog. But I'm like, I'm here. I'm going to go meet this bulldog. And I pull up this beautiful house, and I knock on the door, and this little tiny, like 4-month-old bulldog in a pink collar comes tumbling up to me and pees on my foot and is clearly well-treated, clearly healthy. And I'm like, I need this dog. And so I impulse purchased a dog and then drove it all the way back to Oklahoma. And my mom thought I was crazy. And once you meet a bulldog, they're just funny. And she was perfectly lazy. She was the best dog ever in residency. Happily, I had the best co-residents, and we'd go let each other's dogs out when we were stuck at the hospital. But you know what? Olive did not need to walk very far, so I could take her down the street after I got home from work, and that was enough exercise for her.
Nice. And then before we wrap up with the last question, is there anything within plastic surgery that you feel like we didn't cover that maybe is something that's important for people to know that you just want to share?
I think people should know what plastic surgery is. It is surgery, and it is individualized. So I think a lot of people have dissatisfaction because they'll see something online and say, I want that result, and maybe they can't have it. And a good surgeon should talk to you about limitations of your own anatomy and what can change. I think right now, like TikTok, Instagram culture is immediate gratification. I want this now. You can't also have exactly what you want without healing. So plastic surgery is a fun surgery, but it is surgery. You are getting cut on. It is a medical procedure. It's going to have downtime, and it's going to have, I tell my patients, ugly duckling time. You don't get to look perfect immediately. And there are things that fail, and it's not because you had a bad surgeon. It's because nobody can predict anatomy. There are certain things. I'll look at certain women and say, oh, your rib cage predisposes you to this. Let's do this to try to avoid it. Will it 100% of the time work? No. But can we do our best? Yes. So just like anything else, there are just unpredictable things. But you do need to make sure that you are meeting with your surgeon to talk, like actually seeing the surgeon beforehand so we can look out for those issues. And then if the issues do occur, knowing like implant displacement, like implants can go up, they can go down, they can go sideways, they can move. I mean, they're a weight basically sitting on a rib cage. And so there's not one plastic surgeon out there, even a plastic surgeon who does breast dogs all day, that does not have implant malposition problems. It's just what is done next. And it's not a failure of the surgery per se. It might be limitations of anatomy, or maybe both parties just got unlucky. But I think, of course, plastic surgeons are posting their best results, but there's always going to be non-results. And as long as your surgeon is sticking with you and helping you deal with them or warning of things, like if I see someone who's lost 120 pounds and I've done a breast lift on them, I will tell you, you will 100% sag some. You're not going to be back to where you were before, but I can't make your skin hold the tension that an 18-year-old skin can hold. So we might be back in 5 years to do a little tightening. We might be back in 2 years. Or earlier this week, I did a breast augmentation on a patient who had a very constricted breast, which is a congenital breast abnormality. And she wanted a really round, perky look that's pretty popular online right now. And I told her, I can get you 50% of the way there in one surgery. I was like, you might be happy there, but we might have to do a second surgery because it's not safe to go bigger. It can't be done without killing your nipple or your skin. And she listened. But happily, on her day one, she started crying. She's like, this is better than I even thought. But I think setting expectations and actually listening to the expectation your surgeon sets is probably important.
Do you think that if there's someone out there talking to a surgeon and they don't tell them about potential risk or potential things that could go wrong, they just basically do what you said, see the picture, and they're like, okay, yeah, and they move forward? Is that something patients should be hesitant of, like, why did they not talk to me about this stuff?
I think so. I mean, I spend a lot of time with my patients, and I actually did have a med student with me, and they were following me, and I was pretty aggressive about some of the things, and I was talking to a smoker, and I was like, I need you to stop nicotine. Your nipple will die. And this med student I felt their energy, and they're like, that was really direct. I was like, well, it's really direct when a nipple dies. So they need to realize this is a serious complication. So I think, yes, you can't talk about every complication under the moon, but if your surgeon talks to you about no risks and no possible problems, that's very red flaggy to me, because there's also just problems that can occur after surgery. If you don't walk after surgery, you can get a blood clot in your leg, and that can kill you. And if your surgeon's not telling you that, you might be listening to your mom who wants to take care of you and stay in bed for a week after surgery, which is not the way to recover. So it is a medical procedure. There are risks. There are things that might need to be modified, and it just stings a little more because typically what I do is cash pay. So you're like, hey, wait, I paid for this. I don't want to have to pay for a little modification. And typically most plastic surgeons are not charging full rate for any kind of revision, but there are things that are unforeseen that can happen.
Yeah. Before we wrap up, where can people find you? Where are you guys located at?
We are in North Dallas, 6190 LBJ at Plastic Surgery Center of Dallas.
And online, where can they find you?
At Rachel Walker MD on Instagram, or at Plastic Surgery Center of Dallas. That follows more of our non-surgical content.
Awesome. And then the last question that we always ask people, you can make it specific to medicine or just in general. For somebody who's either in entrepreneurship, thinking about getting into it, or been in entrepreneurship for a long time, what's the one thing that you would tell them, the best advice?
I would say just keep going and be clear on your goals. So don't listen to the no's. Everyone told me not to do it. Everyone told me not to get a big building, but I knew what I wanted. I think if you're wishy-washy on your goals, and I definitely take all the feedback, keep asking, but be dogged about what you actually want and then pursue it. And don't be intimidated by not having the education, because you can do hard things, you can learn. I think everyone who's wanted to be an entrepreneur already did the hard thing. They've learned a skill. And so now this is just a different skill you need to learn.
Yeah, that's great advice. Yeah. Thank you so much, Dr. Walker,
Thank you
for joining us.
Thank you.